Hello guys, welcome back. If you're an old timer, if you're a new timer, this video is about nursing council past questions. So we're basically going through all of them and solving them. So we'll also be explaining which options are correct and which are incorrect. So please go to the description box below and you'll find the link to the first video. So let's continue. The most common preventable complication of abdominal surgery is so as you can see the options right there before you. So what do you think is the answer? But before then, please note that all the options are actually complications of abdominal surgery, but only one of them is the most common and the most preventable. So the answer here is atelectasis. So an atelectasis is actually the collapse of lung tissue. So it is very common after abdominal surgery due to shallow respiration or due to shallow breath. And the way of preventing this complication is very, very simple likewise. So early ambulation is one of them, and also deep breathing exercises. So the next question, the following are prerenal causes of acute renal failure except. So what is trying to say that out of all the options, only one of them is a post-renal cause of acute renal failure. If you take a good look at them, you notice that urinary tract obstruction is a post-renal cause. However, hemorrhage, myocardial infarction, and sepsis are prerenal causes of renal failure. So let's go to the next question. The first clinical manifestation of incompatible blood transfusion is what? It says the first clinical manifestation. All right, please don't be mistaken. What it's trying to say is that all the options could be manifestation of incompatible blood transfusion. What's incompatible blood transfusion? It means when you transfused a mismatched blood. So if you take a good look at the options, pyrexia and skin rashes is actually the first one. So when you transfuse blood that is mismatched, the first sign, all right, you notice in the person or in the patient is that the patient's body temperature will be elevated and there will be visible skin rashes. So let's go to the next question. It says false sensory perception in the absence of real external stimuli is called what? Please, what do you think is the answer here? So the answer is hallucination. Hallucination. So why is it hallucination? So hallucination is actually a sensory experience that seems real but is created by the mind in the absence of an external stimulus. So delusion can't be the correct answer because delusion is a false belief. Deja vu, I think, is just a misinterpretation of real external stimulus. So that's the answer. Hallucination is the right answer. Let's go to the next one quickly. A client tells a nurse that his body is made of wood and quite heavy. This is a clinical manifestation of one of the following. So what do you think is the answer? Without even going too far, the answer is depersonalization. All right, depersonalization. Why do you think depersonalization is the answer? First, you have to know the definition. All right, the definition even tells you that it's the right answer. So it is a type of dissociation, right, where a person feels detached from their body or mental process. It is as if they are observing their body outside their own body. All right, it seems like they are an observer to their own self. So that's what it means. So the next question. The priority nursing assessment for a client with CVA or cerebrovascular accident within the first 24 hours of admission is what? So cerebrovascular accident, another name for it is stroke. All right, so the priority nursing assessment, which means that a person with CVA, you could assess him based on all these parameters, but the priority here is pupil size and papillary response. All right, so in the first 24 hours of a stroke, the top priority is for monitoring the sign of increasing intracranial pressure, of course, and also papillary changes are actually a direct and critical indicator of a change in neurological status. So the next question. The fluid shift in a client with Burns injury result from an increase in what? Please take a good look at the options. All right, the fluid shift in a client with Burns injury. So in client with Burns injury, if you notice, most of them will have edema. So why do you think they develop this kind of complication or signs and symptoms? It's because there's an increase in permeability of the capillary walls. So when there's increase in permeability, what happens? Proteins will leak out of the capillaries. All right, electrolytes will leak out, fluid will leak out, resulting in edema. All right, so that's it. 58. The main goal of treatment in acute glomerulonephritis is what? Please take a good look. I don't think you even need to, spend time here. It's actually maintain fluid balance. That's the main goal of treatment. So what it's actually saying is that, you see, for all the answers we have been, attempting for the past, 7 questions, if you notice, all of them seem to be the answer, but only one is the most correct. And in this case, to maintain fluid balance is the most correct one here. All right, glomerulonephritis is actually an inflammation, all right, of the glomeruli in the kidney, and it impairs the ability to filter water and waste. So the main aim is to maintain fluid and electrolyte balance. They should have added electrolyte balance here. So let's go to question 59. So the first step in applying the first step in applying the quality improvement process to an activity is to what? You can tell me. Let's see. Assemble a team to review and revise the activity. Is it B, is it C, or D? All right. After taking a good look at the question, I feel and I believe that C is the answer. Select an activity for improvements. So we know that the first step in any quality improvement cycle is to identify and select a specific area or activity or process that needs to be improved. So the other options are actually subsequent steps in the process. A, B, and D are subsequent steps. All right, but the first is to select an activity for improvement. Next question, passive range of motion exercises prevent what? You can tell me quickly. Contractures. Of course, contractures is the answer. So passive range of motion exercises where a caregiver actually moves a patient joint. They are used to maintain joint mobility and prevent contractures, which are the permanent tightening of muscles and tendons. Okay, let's go to the next question. The principle of good body mechanics includes what? You can tell me. I won't go through the options, just go through them and answer them in your head. All right, 61. What's the answer? The answer is maintaining a wide base of support. This is the answer. I don't think I need to even think about it before answering it, and so should you. So what is a wide base of support? So a wide base of support, it actually provides stability and balance. Okay, it is a fundamental principle of good body mechanics, and it is used to prevent injury when lifting or moving patients. All right. Okay, so let's go to the next one. The rest of the options are incorrect. This is the correct one. So 62. When performing a breast self-assessment, a female patient is taught to palpate the upper outer quadrant of the breast because this area is what? Who can tell me? Take a good look at the options. If you're a lady, a midwife, a nursing student, you should be able to answer this. The answer, of course, is A. All right, it is because this area is where the breast lumps are actually located. So the upper outer quadrant of the breast, okay, it actually extends into the armpit or into the axilla, and it contains large amounts of glandular tissue. So this makes it a very common site for development of breast lumps, including cancerous tissues or cancerous ones. So 63, the other options are actually not even related. They are not anatomical or physiologically correct statements. So 63, when assessing the range of joint movement, the patient is asked to move the arm away from the body. It seems that this question is incomplete, so I won't even answer it. Well, let's keep it. Let's keep question 63. Let's go to 64. So it says prior oxygenation of the blood affects the pulse rate and it causes it to become what? See, it says poor oxygenation of the blood affects the pulse rate and causes it to become what? Tachycardic. Okay, increased heart rate. So when there's poor oxygenation, what does the heart do? The heart tries to compensate by pumping more harder. So when the heart pumps harder, what increases the heart rate? So that's why tachycardia is the right answer. So I hope you understand the logic. 65. The following are skin traction devices except all right, let's see. A seems to be the right answer. I don't think I've ever seen A as a skin traction device. If you have, please tell me in the comment section. But a balanced suspension traction is actually a type of skeletal traction, right, which involves pins inserted into the bone. So skin traction applies first to the skin and soft tissues. So please, can you just go to Google and search for these options? I think they will show you some images so that you're able to differentiate them next time. All right. So maybe in your council exams or your mock, they might just bring up images of this. So it's good to know them. 66. The premature destruction of erythrocytes occurring at a rate that bone marrow cannot compensate is called what? Please, let's go. It's hemolytic anemia. Please, I don't think we need to even explain why. From the word hemolysis, right? So when your blood cells, your RBCs, all right, they just keep bursting or keep getting destroyed in the reticuloendothelial system prematurely, all right, we call the condition hemolytic anemia. So as for C, D, and B, C, and D, they are actually different forms of anemia. For example, let's take iron deficiency. It's when iron is deficient, right? So let's go to the next question. Question 67. It says Graves' disease is another name for what? Come on, guys. I know you know this. It's actually hyperthyroidism. So Graves' disease is an autoimmune disorder that is most common. It is most commonly caused by hyperthyroidism. Okay, and hyperthyroidism is actually a condition in which the thyroid gland produces an excess of thyroid hormones. So 68, question 68. Dilation of the renal pelvis and calyx with collection of urine is referred to as what? Come on, guys. Hydronephrosis. Where is it? Yeah, hydronephrosis. A, B, and C can't be the correct one. Let's see. Nephrotic syndrome. No. So what's nephrotic syndrome? Nephrotic syndrome is actually a clinical pathological condition, right, in which it's actually a term that is given to a range of disorders affecting the nephron. That's basically it. Pyelonephritis. I think we talked about pyelonephritis in our last video, so you should go and check it out, right? So let's go to the next one. The incubation period of hepatitis B is what? So is it 50 to 180, 50 to 160, or what? So it's 50 to 180. Sorry, you can't see the options clearly, but the answer is 50 to 180. Let's go forward to the next question. The volume of air in vital capacity is what? I can't see the options clearly, but just in case, the answer should be 4,700 mLs. Every nursing student should know this, please. You should have it at the back of your mind, all right? 4,700 mils. So the percentage of oxygen in atmospheric air is 21%. All right, let's go. The pituitary gland lies in the place. Who can tell me the answer to this? 72. Is it A, B, C, or D? You need a very good knowledge of anatomy to know its gross anatomy in specific. So the answer should be, let's see. Yeah, it should be A, the sella tonica of the sphenoid bone. I'll tell you why A is the answer. So first of all, what is the pituitary gland? You know, the pituitary gland is actually a small pea-sized gland, and it is located in a bony cavity at the base of the skull. So that bony cavity is called the sella toxica, right? And it is also part of the sphenoid bone. All right, so that's why A is the answer. So the autoclave is the instrument of choice for what, guys? I don't think we need to go over it. It's just sterilization. Okay. So hope you guys know what fumigation is. You know what radiation and disinfectant is, right? Fumigation is actually used to control pests. Disinfectant is just a chemical used to kill bacteria and stuff like that. Radiation is actually the use of radioactive substances to kill bacteria and some other bad stuffs like that. However, it does not kill 100% of bacteria or microorganisms. So one of the major functions of fat in the body is for what? Who can tell me? Let's see. It's to produce heat and energy. Do you need to know this? Do you need to know why? No. So for now, henceforth, I'll just be explaining why the answers of some questions are wrong. All right, for questions that I feel that you might not know. So let's go to the next one. The thermometer standard scale is most commonly used is what? Let's see, centigrade and Fahrenheit. So is it here? Let's see. Yeah, it's A. Don't be confused. Centigrade and Fahrenheit. So what is rigor? Who can tell me what rigor is? Okay, it is defined as, is it A, B, C, or D? This could be very, very confusing for a lot of people because the options could seem similar. So the answer is sudden severe shivering attack. That's what rigor means. So rigor is a sudden severe shivering attack. All right, so let's should I give you, let me just give you an alternative definition. All right, so it's actually, as I said, an intense shivering attack, okay, and it often precedes a rapid rise in temperature, all right, and it's associated with a severe infection, all right. So for patients with sepsis, this is very, very common. So what does CDA means? Of course, Controlled Drugs Act. Don't need to explain this. Next question. A state of complete unconsciousness when the person's eyes are wide open is called what? I know a lot of you people won't be able to answer this. The answer is coma vigil. Coma vigil. Coma vigil. Okay, if you can see B says night vigil. Come on. Night vigil can be the answer. Maybe C and D. For some people that might guess, they might choose either C or D or A, but the answer is coma vigil. All right. Coma vigil is actually a persistent vegetative state. Okay, it is a condition of severe brain damage where a person is unresponsive, but their eyes are actually open and they appear to be awake. So let's go to the next question. The following are components of school health services except. So for those people who have not been reading your community health or your nursing health, community health, please go back to it. This question is from that. So let's take the next question. The following are components of school health services except. So if you have not been reading your community health, please go back to it, or your community nursing. So the answer here is this. Let's see. All of them. This is just an odd one out question. Actually, the answer here should be environmental sanitation. It's not a component of school health services. So please go and check it out. Just search on Google components of school health services and they will bring them out for you and their explanation, but this is not part of it, I'm very sure. So let's go to the next question. The following are locations for administration of subcutaneous injection except. It says abdomen, lower hips, upper back, and lateral thighs. Now, there's something wrong about this question because all of them are actually sites for administration of subcutaneous injection. But if we are to pick the most common ones, we know that B, C, and D are most common. So abdomen should be the answer in this case. Please note that the question may seem wrong when you analyze the options very well, but abdomen is not a most common site of subcutaneous injection. So we'll go for abdomen. Let's go for 81. The following are classifications of intravenous solution used for fluid replacement except. Now take a good look at it. Out of all the options, actually electrolyte is the odd one out, and I'll tell you why electrolyte is odd. Alright, electrolyte is the odd one. So crystalloid, colloid, and blood products are actually a classifications on their own. However, electrolyte is not a classification, it is just a component of each of them. Okay, so that's why electrolyte is not part of it. So 82, the theory which views the client's adaptive system was propounded by who? You can tell me the answer without thinking much about it. It is Sister Callista Roy. Alright, so if you are trying to guess, of course, you can rule out Florence Nightingale and even rule out Virginia Anderson and then stick to C and D. But if you've read your nursing theory very well, it is D. 82, this is the answer, and let me just tell you why. So you see, Sister Carol Roy is actually a nurse theorist who developed the adaptation model. All right, so she views the person as an adaptive system. Actually, questions on nursing theories don't usually come out much, but you should just know them. All right, so 83, the difference between systolic and diastolic blood pressure is pulse pressure. Let's go to the next one. I don't think I need to explain why pulse pressure is the answer. All right, there's no logical explanation to it. I think it's just the mathematical difference between systolic and diastolic blood pressure. So 84, the replacement of destroyed cells by cells that are identical in structure and function is called what? This is where I know a lot of people fail. But if you look deeply and closely at the options, regeneration should be the answer. Let me tell you why. So what's regeneration? Regeneration is actually the process of restoring lost or damaged tissue by replacing the destroyed cells with new identical cells. So for the other options, the terms are not even related to the process, okay? So let's go to the next one, 85. Another name for antibody-mediated defense is what? Humoral immunity. Humoral immunity. Please go and read your blood physiology very well, or just read immunity as an entire topic. All right, so it doesn't confuse you. So humoral immunity is actually an antibody-mediated defense. So 86. Keratosis caused by friction and pressure from shoe is known as what? It's known as corn. Corn is the answer. So corn is actually a type of callus that typically forms on the toe as a result of friction and pressure from ill-fitting shoes. So when we wear shoes that doesn't fit you, that are very tight, you might develop a corn. All right. So there's difference between this corn and the corn food, or the plant, or maize is very different. They are different. So 87. A visible hard deposit of plague and dead material that forms on the gums line is called what? You can tell me quickly without thinking twice. It is called tartar. Okay, let me highlight it very well. So tartar is also known as dental callus, and it is a hardened dental plaque that forms on the gum lines. So that's what you should know about it. Let's go to the next question. Question 88. In congenital cyanotic heart disease, cyanosis occurs when there is more than dash circulating the oxygenated hemoglobin. So if you want to answer this question very well, you should know the definition of cyanosis. So cyanosis is a bluish discoloration of the skin, and it occurs when the level of the oxygenated hemoglobin in the blood is greater than 5 grams per dl. So where's 5 grams per dl is B. B is the answer. B. So 89. One of the following is not an obstructive lesion of the heart. Let's take a good look at this. Let's take a good look at the option A, B, C, D. Coarctation, pulmonary stenosis, aortic stenosis, and tetralogy of Fallot. Wow, this question seems tricky. So you give me a moment to ponder on it. Let's see. Is it tetralogy of Fallot? I'm not really sure. I'm not sure about this question, so I will leave it. Or rather, please, if you know the answer to this, can you just communicate it to us in the description box below? And I would gladly love to know why you think the answer is one of the options. So 90, a lesion with membranous sac containing CSF and neural tissue is referred to as what? The answer should be, let me see. It should be B, meningomycete. I'm very sure of this. 90 should be B. So a meningomycete is actually a severe form of spinal bifida where the spinal cord and its nerves are exposed and contained in the fluid-filled sac. So the A, C, and D are different neurological conditions. Alright. So we are getting to the end of this video. Question 91. Primary dysmenorrhea occurs most commonly due to what? You can tell me. It is due to elevated level of uterine prostaglandins. So primary dysmenorrhea is actually painful menstruation, and it occurs when the uterine prostaglandins are elevated. All right. So that's it. Let's go to the next one. The normal flora in the squamous epithelial lining of vagina is what? Come on, guys, ladies, please don't discourage me here. Don't make me feel like that you guys are dumb. Okay, so the answer is lactobacilli. B. The following are the ligaments that support the uterus except. All right, let's see this question. So if I understand my embryology very well, I think almost all of them, or if not all of them, I think should be ligaments that support the uterus. So I don't know why they want me to negate only one. Seriously, this question 93 is giving me a tough time. So I think I will just leave it. But I feel like all of them are uterine support. So I'll just leave it. But please, if you know the answer, communicate it to us. Alright? Communicate it to us. So the next question, the act of which there is a threat or attempt to do bodily harm is called what? It's an assault. Let's just go to the next one. A good organizational objective should have the following characteristics, except, who can tell me? So only one of these, the odd one out type of question. So let's see. A good organizational objective should have the following characteristics, except, I think flexibility should be the answer. Or rather, I'm not even sure. Let me check it. Say flexibility, realistic, consistent time frame. I don't think flexibility should be an answer here. All the answers seem similar. I'm not really sure. I'm not sure about this question. I think this question is wrong. This question must be wrong. So we won't be answering it. All right. This question is wrong. This question is wrong. So the father of scientific management is who? Frederick Taylor. So let's go to the next one. The process of grouping similar jobs and putting them into unit is called what? You can tell me quickly. It is departmentalization. So departmentalization is actually the process of organizing job activities into groups or departments based on function, product, or geography. So let's go to the next question. Question 98. A process of identifying goals and objectives in defining managerial responsibilities in terms of expected outcome is known as what? I think it's management by objective. D is the answer here. So management by objective is a management technique where managers and employees work together to set, record, and monitor goals. So that's basically it. So for the next question, saturated fat is a cause of what? You can tell me. Is a cause of coronary artery disease. Coronary artery disease. You know your coronary arteries, right? So saturated fat is actually one of the major causes of this. So what about the last question? The minimum calorie requirement to sustain life in a resting individual is called, who can answer this? The answer should be BMR, basal metabolic rates. So basal metabolic rate is basically the amount of energy the body needs to perform basic life sustaining activities. All right. So thank you very much. If you've come to the end of this video with me, I love you all. Please join me in the next part as we move forward to make you pass your examination. Goodbye.